Good afternoon and welcome, everyone. Thank you for joining me today to lead your training session on Where Germs Live, Body Reservoirs and Healthcare Environmental Reservoirs, a refresher session for EVS personnel. I'd like to thank you for all the work and dedication that you bring to your healthcare profession every day. Before I introduce myself, I'd like to direct your attention to the chat box to find the link to our pre-session survey. Please take a minute to fill this out if you haven't already. And in order to receive your certificate of training, you'll need to complete this. My name is Lisa Ledoux. I'm an infection prevention training liaison with Project Firstline Rhode Island. I've been a nurse for over 30 years, and my professional experiences have been in many different settings, such as acute care, pediatrics, ER, clinical education, home care, and management. Even though my nursing roles and responsibilities varied, infection control and prevention are always in the forefront of my practice. I'd like to invite Dr. Kearney to introduce herself at this time.
Hi, everyone. My name is Alexis Kearney. I'm one of the consultant medical directors here at Project Firstline and an emergency medicine physician. So we're happy to be here with you.
Thanks, Dr. Kearney. So please take a moment to introduce yourselves in the chat feature on this webinar and tell us where you're from. I'd also like to introduce Abby Anderson, who is our Project Firstline Rhode Island project assistant. And the Project Firstline team is behind the scenes in support of this webinar. Abby will be posting information for you throughout the webinar via chat. And it's very nice to meet everyone. And I'm happy that you're all able to join me today for today's session. One more quick reminder, please fill out that pre-session survey if you are interested in receiving the certificate of training. You want to do that before this session gets underway. Your work is very important to controlling the spread of germs and preventing infections. EVS technicians come in contact with many patients daily, and the cleanliness of the environment, whether it be a hospital, outpatient setting, or long-term care, is often the first thing a patient notices when entering a healthcare facility. That first impression can set the stage for that patient's experience. I think we could all agree that the healthcare environment is contaminated with germs. Germs are everywhere, and most we cannot see. All healthcare workers, including EVS workers, work together to help create a safe environment and promote patient healing. An EVS team can cover a variety of roles, such as EVS technicians, shift supervisors, managers, or educators. EVS workers ensure the safety for patients, staff, and visitors by maintaining a clean and disinfected environment. You all play a vital role in healthcare. And no matter what your role is, it's very important to be current with infection prevention and control training, understand your facility's policies and procedures, and know the appropriate cleaning agent to use for a specific germ. What EVS workers do can make the difference and mean the difference between someone picking up a germ and getting sick or not picking up that germ and avoiding infection. So today's agenda for the session. We just went over our introductions. We'll go over our learning objectives. And we're going to review how germs spread and cause infection, define a reservoir, and then review body reservoirs and environmental reservoirs in healthcare. There'll be a quick scenario for us to run through, and then a reflection. We'll go over our key takeaways. I have some announcements and end of session feedback, and then we'll follow that with a Q&A. So learning objectives for today. The learner will understand the 5 elements that cause infection and how germs can be spread from each reservoir and cause harm. Also identify reservoirs and pathway as it relates to infection control in healthcare. And review infection control actions related to your role as environmental service personnel. On busy days, there is pressure to work faster and to get the room ready for the next patient. The room turnover is different in a hospital versus an outpatient setting versus an operating room. This causes a big challenge for EVS departments that face the demand for a rapid turnaround time. There's that throughput pressure from admitting and nursing departments for the fastest possible turnaround time. And this can result in shortcuts in cleaning. So poor environmental cleaning and disinfection can lead to germs spreading and causing infections. The EVS worker's role differs depending on the type of facility you work in. In an outpatient clinic or a physician's office, the rooms require to be cleaned frequently due to the following factors. There's many patients that are seen in one day in that same room. There's also patients that move in and out of those rooms frequently. And there are many patients and providers using that same area. For some of you that work in an operating room, you're cleaning in between surgical cases and then performing another thorough disinfection at the end of the day. So each type of healthcare setting has different processes. It's important that when you are preparing to clean a patient's room, you're not only taking into consideration the health and safety of others, but of yourselves too. Precaution signs are posted outside of a patient's room for all people entering the room to adhere to. It's important as EVS workers, you are aware of the type of precautions to take and the recommended personal protective equipment, the proper PPE to wear. You all have the shared responsibility to help stop the spread of infection by working together with leadership and your coworkers to identify infection risks. It's important for you as a team to prioritize areas that may cause some immediate safety risks. And following facility guidelines for cleaning and disinfecting. These guidelines differ based on your role in the type of healthcare facility you work at. EVS staff play an important role in preventing infection in healthcare. You can save lives by helping to prevent infections. So let's start with reviewing the 5 elements needed to make people sick. All 5 of these elements must be present to cause someone to become sick, but they do not have to be in any particular order. So first, germs need a place to live. We call these reservoirs. Reservoirs are the home for these germs. They can be in and on the human body and also in the environment. Second, germs need a person to infect. That person could be a patient or you or one of your coworkers. Third, the germs need to survive so that they're able to still make someone sick. And fourth, germs also need to get around the body's natural defenses to make someone sick. They need to find a way to get into that person. And then finally, germs need a pathway. Because they don't typically can move on their own, or at least not very far, germs need they need to find a way to get from where they live to another place or person. They need to find a way to move around. So let's put all 5 of these elements together and create a scenario. So let's say that you have a patient, you'll see a patient that just received chemotherapy for her lung cancer in the clinic. The patient is placed on a stretcher to be transported to get an X-ray. The patient is sick and vulnerable and susceptible to illness. She has an IV access for her medications and fluids. So we've got the susceptible person, right? That's this woman who has cancer. She's very sick and vulnerable. The reservoir, germs. The germs could be living on the handrails of the stretcher. And that stretcher may not have been cleaned well or not at all. And that's where there's germ survival. The patient has an IV and a weakened immune system due to the chemo. So there's a breakdown of the body's defenses. And then lastly, the pathway, that's where the patient is touching the rails of the stretcher. So we're going to get into pathways now. There are 4 main pathways, ways that germs can travel and move into the patient. For germs to spread from reservoirs in healthcare, they need one of these pathways, or they could travel by all of them. The first way germs can travel and spread is through touch. That usually involves the skin, especially the hands. It involves contact with a person's skin or contact with an object. It could be via, by handshaking, or it could be by touching an object, cell phone, door handle, or a medical device. Think of all the things that you touch in your workday. Another pathway for germs to spread is through particles that can be breathed in. Inhaling infectious respiratory particles or exhaling infectious respiratory particles by sneezing or coughing, laughing, or singing. If someone is sick and coughs or sneezes, they can send some infectious droplets from their lungs into the air. A third pathway is through splashes or sprays. This could be splashes or sprays of blood or body fluid or water from a sink. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or a break in their skin and cause infection. And the last common pathway for germ spread in healthcare is by bypassing or breakdown of the body's natural defenses. Like when an IV breaks a skin on insertion, that creates a pathway for germs to enter into the patient's body. Or if someone has a cut or an open wound, that is a breakdown in the skin, which is one of the body's defenses for germs. And skin is one of the body reservoirs that we're going to be discussing today. The human body has many areas where germs can live. These germs can live on our bodies and also live in our bodies. It's important to learn these body reservoirs in order to help keep germs from spreading. So before we dive into discussing the body reservoirs, let's just see what your thoughts are. I invite you to share your answers. You can put them in the chat. Think about this question. What parts of the body or body system are the most likely to cause a risk for germs to spread in healthcare? So again, if you'd like to share your answers in the chat. Excellent. You see the gut. Suzanne put mouth. Tabitha, skin. Yeah. Where there is moisture. Skin and hands. Excellent job. I appreciate you all sharing. So now let's go through them. See how many of you got them right there. So here are 4 of the body reservoirs that we're going to go through today. Skin, which some of you had said. Also the gut, the gastrointestinal system, we also call it the gut. The respiratory system, and blood. And for each reservoir, I'm going to go over some key facts, how these germs spread from those reservoirs, and ways for you to protect your patients, yourselves, and your coworkers from the spread of infection. Okay, skin. So skin, we're going to start with this one. Skin carries many germs and spreads them easily. And as I said earlier, skin is a barrier, and it serves as one of the best lines of defense against harmful germs. However, the skin is also a great place for those germs to live. Broken skin, including dry, flaky skin, is likely to be more susceptible to these germs. It's important to keep your skin moisturized and free from cracking or peeling, especially in the winter months. Many germs live and grow on healthy skin, and some of those germs can be harmful to vulnerable patients. So when hands touch surfaces, germs can spread from those surfaces to that person and then to others. Think of all the objects you touch daily, whether it be in your healthcare setting where you work, grocery store, or even at home. We can carry and spread infection and not know it because most of these germs we cannot see. There are a lot of important things to remember about skin for infection control. Germs can spread from skin, as it happens a lot, mostly through our hands because we use them so much. Touch is a major pathway of spread to and from skin. Even when you think you cleaned your hands well enough, germs on your hands can spread to people and surfaces, and your skin can also pick up germs through touch and spread them to others or to yourself. Some examples: direct contact with another person, as I mentioned, shaking hands, or taking a patient's pulse, or touching objects such as door handles or elevator buttons. Another way germs can spread from the skin is breaking down or bypassing the body's defenses. We also do things in healthcare that break patients' skin, like I mentioned earlier, inserting an IV or treating patients with surgical procedures. And when that happens, germs on the skin surface can be pushed into the bloodstream. So here are some infection control actions that you can take to prevent the spread of germs from your skin. Cleaning your hands is the #1 way to prevent the spread of germs. Cleaning your hands, I'm referring to washing your hands with soap and water, or using an alcohol-based hand sanitizer. Sorry about that. Using personal protective equipment. PPE is a protective barrier that keeps you and your coworkers and patients safe from potential spread of germs. It protects your hands, face, nose, eyes, and also your clothing from germs and chemicals while you're working. In cleaning and disinfecting objects and equipment, taking the time to purposefully and thoroughly clean medical equipment and objects. As we discussed earlier, shortcuts in cleaning and disinfecting these objects or surfaces can lead to serious infections for some patients. And the next slide, we have here's a poster. Some of you may be familiar with it, but it's each reservoir I'm going to go over today. There's going to be a poster for each one. These are fantastic. It's a summary of each reservoir as I go through them. And they're brought to you by Project Firstline Rhode Island. And Abby's going to show a link. You can actually download and print these posters, share them with your staff or hang them in your work areas. They're really great. So again, each reservoir, you're going to see a link to a poster that you can download. Thanks, Abby. Okay, so moving on now, let's talk and discuss the GI system. The GI system reservoir, the gastrointestinal or digestive system. It has 2 parts, the upper GI tract and the lower GI tract. The entire GI system from mouth to anus is referred to as the gut. Most GI germs that cause infection come from the gut. Because these germs live in the intestines, they're also in our stool. And these germs can be on the skin, around the groin, the hands, or also in the environment. These germs in stool can spread onto hands, and if they're not cleaned well or properly, these germs can spread to toilets, sink handles, stall doors, and potentially make others sick. Germs from the gut travel easily in stool, and they're often found in the environment, like on surfaces in the bathrooms. And touch is a major pathway for the spread of these germs. An example, if you're taking off soiled linens off a bed or a stretcher, you may get some germs on your hands or clothing, which can then spread by touch with other people or surfaces. So as you are cleaning a patient's bathroom or public restroom, it's important to know the potential for these germs to be on these surfaces in that area. Cleaning restrooms frequently and properly, from dirty to clean, there's a process for each of you. All you know that when you're cleaning certain areas will help to decrease the risk of spreading of these germs. Germs can also spread by splashes or sprays, from flushing a toilet or emptying a bedpan into a toilet. Another way these germs can spread is through procedures such as a colonoscopy or surgeries, and this is bypassing the body's defenses. Here are some infection control actions you could do. Cleaning your hands, again, number one way to prevent the spread of germs. Using personal protective equipment, PPE, like gloves and gowns. Cleaning and disinfecting surfaces and devices, bed rails, bedside tables, call lights. Carefully handling linens. Remove the linens from the bed or the stretcher carefully and assure that the bedding is rolled up to avoid any of the stool from escaping. And you want to keep that soiled linen, right, all of it rolled up in a ball and carry it away from your body as you're going to put it into the soiled linen bin. Managing trash and waste appropriately. Assure the trash bin is not overflowing and posing an infection risk to others. And here is the next poster that sums up everything on the gut. Our third reservoir we're going to review is the respiratory system. The respiratory system consists of upper and lower airway. The upper airway includes the nose, the throat, and the windpipe, and the lower airway includes the lungs. Many germs live in the upper airway, and germs in the nose and the mouth can easily be spread to the skin and hands when you touch your face. And then from there, they can spread to surfaces and other people. And the defenses of the nose, mouth, and the throat also help to keep germs from getting into the lungs. There are a few pathways for germs to spread from the respiratory system. Breathed in is a key pathway, of course, because these germs can be spread through respiratory droplets. And a respiratory droplet is fluid that comes from a person's mouth when they speak, cough, or sneeze. So if an infected person talks, breathes, laughs, or sneezes, they're producing fluid that goes into the air, and it could spread germs for another person to be breathing it in. Respiratory droplets can also be spread by splashes and sprays to the eyes, nose, and mouth. And then touch is also another key pathway because germs in the respiratory system spread easily to the skin and hands. And from there, they can spread to other people and surfaces. Example, if someone coughs into their hand, then they go and touch an elevator button. And then someone is right behind that person touching that same elevator button, and then they touch their face. So you can see how the spread of these germs can easily happen. And here are some infection control actions that you can do to help prevent the spread. Respiratory hygiene and cough etiquette. Coughing into your elbow. Cleaning your hands properly. If you use a tissue, disposing of the used tissue properly and then following with hand hygiene. Source control. For source control, you want to wear a mask that covers your nose and your mouth to prevent the spread of respiratory droplets or respiratory fluids from yourself to others. Ensuring good ventilation. Germs are more likely to spread in places with poor ventilation. So as you go about your day, look and see if you're cleaning a room or an exam room, if you see a blocked vent, they could easily be blocked with waste baskets, a chair, or a laundry bin. And if you're able to move it away from there, then try to do so. Or if you see a vent that is blocked by something that cannot be moved, try to make sure you notify the proper person in charge of that area. Using personal protective equipment like respirators and gowns. Cleaning and disinfecting objects such as bedside tables and phones. It is important for you to be prepared and protected. You may be assigned to clean an occupied room that a patient is receiving a nebulizer treatment. If they're getting, a respiratory treatment there. Infectious respiratory fluid can be going in the air. And as I mentioned earlier, be alert for signage on or near the entry of a patient's room. When cleaning an occupied room, you always want to know if there are specific precautions and recommended PPE to use prior to entering that patient's room. And here is the poster on the respiratory system reservoir. The last body reservoir is blood. Unlike other parts of our body, like the GI tract, blood is not supposed to have any germs in it at all. Some viruses can cause blood infections such as hepatitis or HIV. That blood can then spread the virus to other people if untreated. If blood gets on germs in the environment, like on linens or a device, those germs are likely to grow and multiply, and then they could spread. So germs from blood can spread by the following ways. Touch. If there's a blood drop on a surface or a device that was not properly disinfected, touching that surface can allow germs to spread. Splashes and sprays. Again, another pathway for blood infections to spread. Maybe your EVS supervisor may have assigned you to clean a room in an ER where a trauma patient was treated. Most likely the trauma room will have equipment misplaced all throughout the room. It will look chaotic. Carts contaminated, used emergency supplies can be on the floor. They could be anywhere. There could be blood on the ceiling, on the walls, and on the floor. You could pretty much assume that everything in that room is contaminated. Another pathway is breaking down or bypassing the body's defenses. You want to be really careful of unintentionally getting a needle stick. If there's a contaminated needle or a sharp object that was disposed of in the wrong container, or if it's in an overflowing sharps container. So here are some actions, some infection control actions that you can do. Again, number one, cleaning your hands is the number one way to prevent the spread of germs. And again, that's with soap and water or with alcohol-based hand sanitizer. When sharp containers are overfilled, the risk of getting accidentally stuck by a needle is greater. The biohazard container can fill very quickly, and also sharp instruments can be dropped in that container without safety devices intact. So safe practice is to monitor them for overfilling and replace them before they become too full to put others, preventing from putting others at risk. Using personal protective equipment, PPE, again, like your gloves, your gowns, eye protection. And if you're cleaning rooms in that, like that trauma room I just mentioned, or if you're in an OR, shoe covers, the shoe booties should be worn. Be aware of linens that have hidden sharps that may have been accidentally left behind. And handling linens carefully, again, if there's any contamination, make sure that they're rolled up tight from any infectious, material from escaping, and keep it away from your body when you're disposing of it. And cleaning and disinfecting surfaces and objects in the patient's room that's been contaminated. And here is our last body reservoir poster on the blood. And Abby will show that link. Thank you. For the second half of this training, we're going to talk about where germs live in the healthcare environment. Some of you may work in hospitals, ambulatory care, long-term care facilities. Whatever type of facility or specialty area you work, there are many places in the environment for germs to live and cause a risk for infection. So I invite you again. Here's another question. I'd like to hear your thoughts if you'd like to share it in the chat. Where do you think germs live in the healthcare environment? If you think of any of those, feel free to put them in the chat. In the air, handrails, remotes, bathroom. Yes, computer keyboards and doorknobs and light switches. Excellent job, guys. Thank you. Thanks for participating and sharing. So let's go through these now, okay? As we know, germs are part of everyday life. The world is covered in germs, especially in healthcare. When we think about the germs living in the healthcare environment and the steps we can take to keep these germs from spreading, we think of these 4 places where germs can live. Water and wet surfaces, and that can include sinks, faucets, drains, and ice machines. Dry surfaces, such as bed rails, privacy curtains, countertops, bed linens. Dirt and dust, caused from, like, if there's any construction being done nearby or maintenance, repair, renovations. And last, devices, such as stethoscopes, blood pressure cuffs, any dental tools. So each of these environmental reservoirs has an impact on your daily work lives. And the first environmental reservoir we're going to review is water and wet surfaces. Water is used a lot in healthcare and in many ways. As EVS workers, you are working with water and wet surfaces frequently in your workday. You use the sink to fill buckets up, mopping floors with water and cleaning up spills. Because most water and wet surfaces are good places for germs to grow, it's important to be careful with water in healthcare. Water exposures in healthcare settings and during healthcare delivery can place patients at risk for infection with water-related organisms and could potentially lead to healthcare-associated infections. So what if you're cleaning a patient's room or you're cleaning a restroom at an urgent care center, let's say, and you see a leaky faucet. Do you think that that is anything to be concerned about? And should you report that to the proper person to get fixed as soon as possible? So thanks for sharing. And Nicole, you put yes. Yes, it is a concern, right? And it should be reported quickly, because that leaky faucet can cause water to stay in or around the sink and harbor germs and allow them to grow and multiply that could be picked up and passed to others. Think of some possible infection risks associated with some interactions in your role with water and wet surfaces. And some interactions could be getting rid of standing water, making sure surfaces like countertops are dry, and not using tap water when you should be using sterile water. Germs can spread by water in a few ways. Touch, when you get germs from water on your hands. Germs can also spread by splashes and sprays, and not just into your eyes, nose, and mouth, but those splashes and sprays can also get on your skin or equipment. Breathed in is another way that germs can spread by water. When water gets into the air as a very small droplets, it can be breathed in and carry germs to the lungs. And also another way is ingesting contaminated ice chips or ice, or water. So here are some infection control actions that you could do to prevent the spread of the germs from water and wet surfaces. Again, cleaning hands, as we know, is the most important #1 action. In addition to hand hygiene, healthcare providers should pay careful attention to all recommended infection control practices. I mean, a lot of you are doing rigorous environmental cleaning to reduce the risk of spreading those germs, like terminal cleans, cleaning and disinfecting environmental objects and devices. Some of you may have the task of frequent cleaning of ice machines or eye wash stations, or even the water therapy pools in an outpatient physical therapy clinic. Also, keeping healthcare supplies that are used during patient care should not be kept near a sink where tap water can get these items wet by splashes and sprays from the faucet. Remember, tap water is not sterile and it can contaminate those supplies. And then using the proper PPE, such as your gloves, your gowns, and eye protection. And as EVS leaders, it's important to assure that your staff has the proper PPE and it's readily available. And here's the poster on germs that live in water and wet surfaces. Next is dry surfaces. They include high-touch surfaces. As you're going about your workday, it's important to be aware of what high-touch surface is. And a high-touch surface, right, it's surfaces that are touched by multiple people frequently throughout the day. EVS workers, as you know, you interact with high-touch surfaces multiple times in your workday. Multiple people touch objects such as a call bell, the elevator buttons, common areas in a cafeteria, tables and chairs. Some other high-touch surfaces that some of you are working with in outpatient areas: furniture and exam rooms, procedure tables, door handles, light switches. If these things are not cleaned regularly, the germs on them can easily be picked up and passed around by anyone who touches them. Many germs found on the body, in the air, and in the stool can end up on dry surfaces, and they could spread very easily. Hands can pick germs up and move them to other surfaces and people. And germs from dry surfaces can also get in devices that can be spread for those devices that are shared amongst patients or coworkers. Certain germs, like spores from C. diff, can live on dry surfaces for a long time. For some of you who may not be familiar with what C. diff is, I'll just do a little quick overview. C. diff is a bacteria that causes severe diarrhea. It is spread through feces and it's highly contagious. And common surfaces where it can be found are toilets, bathrooms, countertops, and linens. So it's important for you to know which agent to use to kill that C. diff spore. It's important that EVS leadership also assures that your EVS workers know how to read a disinfectant label. Abby's going to show a link to a site where you can how to read a disinfectant label. And that link is going to show you how to look up the appropriate cleaning agent, how to use it, what surfaces to use it on, contact or dwell time, and how to store or dispose of the disinfectant agent. And as always, if you're ever uncertain on what procedure or product to use, always consult with your EVS leadership. These bacteria, like C. diff we just talked about, can spread by the following pathways: by touch, especially our hands. Think about those door handles or vital sign machines that are shared among many patients, the computer keyboards, and also breaking down or bypassing the body's defenses. Again, medical devices, a needle or ultrasound wands. So important infection control actions that you can do. Again, cleaning your hands, cleaning and disinfecting surfaces and devices regularly, frequently, sterilizing devices and equipment. And you always want to make sure that you want to make sure that you clean all areas as if it was the worst germs that were present on all those items. And you always want to make sure you're wearing the proper PPE while doing so. And here's the poster on where germs live on dry surfaces. Germs also live in dirt and soil. And usually they don't make people sick. If they get inside a healthcare facility, they can cause harm to patients with weakened immune systems. Outdoor construction projects near a healthcare facility or indoor projects like you might see maintenance working on, ceilings or near windows. And that can send dirt and dust into the air. The dirt and dust can have germs in it, and then that can cause harm to some of our patients. These germs from dirt and dust can cause infections by being breathed in. An example of this, if let's say you decide to go clean an occupied room, you always want to avoid cleaning or dusting above a patient's head. That can allow for the germs in the dust or the dirt to get pushed in the air and breathed in by the patient and potentially causing infection. Touch is another way for these germs to spread. So again, some infection control actions that you can do to prevent the spread of germs with dirt and dust. So again, as we know, cleaning our hands is the number one infection control action. Maybe you might need to use an N95 if working with dirt and dust. It'll help protect you from breathing in those germs. Ensuring good ventilation is another infection control action, and that's going to allow for the dust particles to be filtered out properly to decrease the risk of breathing in these dust or dirt with germs in them. And again, cleaning and disinfecting surfaces that may have dirt and dust that have settled on them. Like I said, you might see a maintenance worker that is either in the hallway or in a patient's room, repairing a ceiling tile or a ceiling vent. That repair work can cause the dirt and dust particles to float in the air and settle down on the surface, or it could even go on the ground. So, just try to remember after maintenance is done, you want to try to go back to that area and clean the area below from where that dirt and dust could have settled. And here's our poster on germs that live in dirt and dust. And the last environmental reservoir for germs in healthcare we're going to review today are devices. And this list can be absolutely endless if you think about the different equipment that's used in various healthcare settings. So just to name a few, stethoscope, endoscope, nasal cannulas, blood pressure cuffs, or dental equipment. If devices that are used on or in a patient's body aren't cleaned and disinfected correctly, germs can grow on those devices and provide a common place for germs to grow. Touch is a way that these germs can be spread by these devices, especially devices and equipment that is shared by multiple healthcare workers and patients. When devices are used on or in a patient's body, the devices can be the entryway for that germ to enter the body. Think back of that patient we talked about earlier that had cancer, right? That patient is at greater risk of getting sick from some of these germs. Her body can't protect as well as healthy people. Or surgery and invasive procedures such as a colonoscopy or other ways of breaking down the body's defenses. And some infection control actions that you can do to prevent the spread of germs from devices. Again, cleaning your hands, number one way, right? Sterilizing high-risk devices, using PPE, proper PPE all the time, cleaning and disinfecting objects. Keep the patients, yourselves, and your colleagues safe when you're clean and disinfect medical equipment properly. Does your workplace have designated areas where you put dirty equipment and clean equipment? Are they labeled clearly? And here's our last poster on germs that live on devices, and Abby will show the link to that. Okay, so here's a scene. I want you to take a look at this scene and see there are many germ reservoirs that are in the scene. Okay. So after everything we just reviewed on the reservoirs, I want to see how many you can try and spot in this picture. And I'll give you some time, put your answers in the chat, and then we'll move on and see how well everybody did. Okay. So just check it out and see where you could find a lot of the reservoirs that we just reviewed in this picture. Yeah, I'm seeing good answers. All right. So let's move on to the next slide and let's see how well everybody did. I think you guys all did great. Okay, so a lot of these you see, you all named them. A lot of you did them. So ready, water and wet surfaces. They're at the sink area right there. Dry surfaces, the countertop. Dirt and dust. There's in the hallway where the maintenance just repaired the ceiling vents and created some dirt and dust to fall on the floor. High touch dry surfaces, the door handle, the privacy curtains, the bed rail, IV pole and pump. You guys did a great job. You picked up on those. Skin and hands, the healthcare worker at the cart, right? And on the cart, if you could see it, there's blood, the phlebotomy tubes. There's blood tubes that are sitting on the cart that are not in biohazard bags. Respiratory reservoir, the patient talking to the healthcare worker. Gut, the patient's GI system. And devices, there's a pulse oximeter on the patient's finger. And on the cart, the stethoscope and the blood pressure cup are hanging right there on the cart. So before we end this session and go over the key takeaways of this presentation, I'd like to have you all reflect on what we reviewed today. You do not need to enter any answers unless you'd like to share. But knowing now where germs live in the body and in the healthcare environment, how will you apply this knowledge in your role? So again, it's just something to reflect upon. We did go over a lot today, but how will you apply all this knowledge in your role? You'll remember these reservoirs as you're going about your workday. And the key takeaways. Germs are always present, and there are 5 elements needed to help germs cause infection. Knowing where these germs live and how they spread is the first step in infection control. It's important to understand how these germs leave where they live, which is their reservoir, and spread to other areas in the healthcare facility, including other people. When you understand where germs live and how they can spread from place to place to make people sick, the infection control actions you take to keep them from spreading become second nature. EVS technicians are key players in infection prevention and control. You save lives by helping to prevent infections. You all work so hard, and I thank you again for all that you do for our patients in the community. Your roles are very important. So in order to receive your certificate of training, again, you must have completed the pre-session survey at the beginning, participate in today's session, complete the post-session survey, and that link for the post-session survey will be sent to you via an email tomorrow, August 1st, and it will be available for 1 week. That survey closes at midnight on August 7th. Once you complete the requirements, a certificate of training will be emailed in PDF form on August 10th. And post-training resources and this PowerPoint will be emailed to you sometime this afternoon. If you did not enter your email earlier in the chat box, please feel free to enter it now so you can be added to our distribution list of upcoming trainings, or you can email us directly. You can follow Project Firstline Rhode Island on social media. We're on Twitter, Facebook, Instagram, and LinkedIn. And we're very excited we have some great upcoming sessions. Our next one, we're excited to announce that the session that I just presented to you today, Where Germs Live, Body Reservoirs and Environmental Healthcare Reservoirs, a refresher session for EVS personnel. It's going to be offered in Spanish language. And my colleague, Jacob Figueroa, will be presenting this training next Monday, August 7th at 12 noon. So please tell your friends and colleagues and have them join us next Monday. And here are the references used for today's presentation. I invite you to please take this 3-question poll on your screen. This really helps us to improve future sessions and assess your learning needs and requests. On behalf of Project Firstline Rhode Island, we thank you again for joining us today.